Okay. This one, X. Okay, can you see the study guide?
Yes.
All right. The first one, 12 months milestone development. Okay, so 12 months, what happened? Wait a second, let me go get my book. Okay, wait. Okay, 12 months milestone. That means the 1 year. So what happened to the 1 year? What?
Yeah, mobile walks, runs, jumps,
Mm-hmm. And
and then walks up and down stairs. And
yes.
then one foot at a time.
Okay.
Their anterior fontanelle begins to close.
Yes. Right. Okay. So how about the hand? The hand can grab something, right? So in like 1 years old, because like 1 years old, they start to try to grab some kind of like a food and a toy. So if they can grab something, it's something kind of like a necessary, it's kind of like a concern. So this is one thing, okay. And what else? So how about they can? How about they're sitting? Can they sit alone or they need a support?
They're able to sit alone.
They can sit alone by themselves. It's 1 year old already. So that's why they should not have any kind of like a parent support, and that's why they can sit. And they will know their name, but they cannot speak yet. And probably it's playing along, right? In the frontal nail. Okay. And walking with holding the furniture, okay? So one answer is here. All the clue is one of the answer here.
Cruising?
I'm not gonna tell you the answer, but one of the answer we talk about here, we talked about a little bit earlier, is here. Okay, 12 months, that means 1 years old, milestone. Okay, so now milestone usually is not difficult as long as you just remember and you get a point. All right, so 6 months milestone development. What happened to the 6 months?
They double in their birth weight.
Yes, correct. How about the sitting?
With support.
Yes, good.
And then begins a strange anxiety and the separation.
Yes, some kind of separation anxiety. Okay, so they will cry if they don't see their parent, especially the mom. Okay, if they'll cry if they cannot get engaged with their mom. Okay, and can they just roll over? Can they turn? Be careful what I ask. Okay, can they roll over in this 6 months yet?
Yes, they start crawling.
Yes, they're crying. Yes, they also can roll over. Their roll over is by one side or two side.
On one side.
Well, they can start crawling. That means it's two side already, so they can roll over for both side, left side and right side. Okay, so one of the answer is here. All right. Then the 2.5 years old child. So it's Erickson stage. Okay. The let's see the 2 years old. Okay. So this child just keeps saying no. This is a very big one hit I give it to you. Okay. The child keeps saying no, 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 no. So go back to see your milestone. So what is this behavior?
It's autonomy versus shame and doubt.
Yes, but also this behavior and have like a very special. It's not a medical term.
The
Territory.
tantrum?
Say that again.
Tantrums?
Yes,
Ah,
that's not something I want to give it a hint. Okay, they're being very negative. Say no, 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 no. I don't want this. I don't want that. Blah, 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 like this, and have like this kind of behavior. Okay. All right. So number 4, 2 years old child safety. So the child accident swallowed with a cleaner. So what's your intervention? So this one I didn't say that very clearly, and I don't think I even say this. I don't put in my PowerPoint. So this is kind of like an extra knowledge. Okay. When I see the question, that's why I find out. Oh yeah, I need to tell you. So when the child they just accidentally just swallow something, what's your intervention? Do you feel like you need to call 911, call a hospital?
poison control.
We call poison control first. Yes. So after poison control, after that, they will give you the guide, right? Maybe you need to go to a local ER. Okay. So another thing is how about the epic? This is some kind of like a solution. The cereal with an epic. Do you know what is this? This is kind of very old style, and if you have some certain age in the United States, you probably know what is this. This is some kind of like a solution. So it's when you drink it, it will induce a vomiting, will force you to vomit out something in your stomach. Okay, so that's why some very old timing. So if we unfortunately inducing some kind of food or some poison, we have this kind of solution. That's why you drink this immediately and will help you to vomit out the food in your stomach. But I'm telling you, okay, so now, these days, we do not encourage you to do this anymore. Don't use this anymore. Never, never use it because it will cause aspiration very easy. And also because the cleaner, there actually is kind of like a more alkaline or more acidic solution. It's gonna burn the esophagus. It's gonna burn the mouth, burn the esophagus. So that means you don't let the children just vomit out. So how about if unfortunately it just swallow some kind of solution? Yeah, go to the local ER. So they probably were doing like a lavage. You still remember lavage? What does that mean, lavage? We put a tube inside and wash out your stomach and suction out with all the solution. Okay, and here the question also asking you. So, the parent is telling you, okay, should I just move the cleaner on the top or lower shelf?
The top.
Because it's a top. Okay, you pull the lower part, and then the children were gonna get it very easy, right? All right, and lock the cabinet. Yeah, it's always a good behavior. Okay, just lock it. That's why they cannot open it. Okay. So, number 5, milestone, each age of task code. Okay, 18 years old, 24 years old, 2 years old, and 3 years old. Okay, so what I put this is because this question is asking you these 4 patient or 4 kids, which one is the most one you need to concern? That means what? One of the kids is not reach the milestone. It's delayed. It didn't match with a milestone. So that's what you can see here. So 1 years old and 1.5 years old, 2 years old and 3 years old. So that's why going back to see your milestone with all this kind of like detail. So one kid did not reach the milestone. That's why it brought your concern. That's why you need to call this kid coming back to the clinic, have like a follow up to check. Okay. Number 6, 9 years old, the children, the Erickson stage with psychosocial development. 9 years old. 9 years old is a school age. Sorry.
It's industry versus inferiority.
Yes, thank you. Okay. Number 7. 10 years old child, normal physical development. Okay, so here is the thing I give you a very big hint. The preschool and the school child's kid and growing is kind of stable. So that's why they're asking you, okay, the parent just bring to the child, you have a examination, the 10 years old will exam. So that's what the parents tell you. Is my kids growing up? Is that normal? So that's why I'm going to give you the normal the range. Okay, so each of the year, if they grow like a 2 to 3 kilogram, which is means like a 5 to 7 pounds, that's normal. So how about the height? Each of the year growing like a 2 inches of height. Okay, every years, that's normal. Okay, that's normal. So remember I told you the two growing faster ages is kind of like infant and also adolescent, right? So that's why after the infant become like a toddler or preschool, and they should become like a more normally and stably growing up. So that's why it's not suddenly growing up so much or just not growing at all. If they're growing too much and too big, you need to consider about it's kind of giantism. So that means that the growth hormone is too much. Too much, that's why suddenly just going so high and so big. That's also another concern, okay? So remember this number, okay, because it's going to be happening in your quiz. So the quiz is going to tell you, okay, so I'm growing up for this kind of like how many inches or how many pounds. Okay, it's my child. Is okay. Is that normal? So that's why you will make your judgment. Number 8, 15 years old child who has a type 1 diabetes mellitus. So nursing intervention. So 15 years old is about what? Is a teenager, is adolescent. Okay, so this question is telling you, okay, this adolescent actually because of type 1 diabetes and unfortunately admit to the hospital. So what's your nursing intervention? Do you feel like this adolescent you want to live it with the visitor, don't want the visitor to come to see him? And do you think the adolescent you want to tell him, okay, you need to stay in the hospital with the parents only? What do you think? Is this a good idea?
No.
No, because it's a teenager. They're really looking for the peer guru, right? Okay, number 9, high school freshman. So leading cause with the accident death, the reason. Okay, they tell you some kind of accident caused the death. Okay, like in each of the pediatrics they have a different reason they cause their death. So for the infant is SIDS, right? SIDS. Okay, this is one of the reason because they've been covering with too much blanket or toy, or they just have like a prone position. They're sleeping, that's why they cannot breathe. But after that, for example, like a toddler, so the toddler they start walking, that's why they go to everywhere, right? So that's why get a burning or a drowning. Because if you have like a bathtub or like a swimming pool, they probably will drown. And also, if you just cooking something in the kitchen and you just walk away and they will try to reach the kitchen, the fire, that's what will cause the burning. And also fall. So they will be kind of starting climbing on the stair when they fall on the stairs. So it could be cause like a injury or maybe die. This is toddler. So preschool, usually they happen like an incident in a school. And that's preschool, school age. School age will happen an incident in a school. So like a fracture or like a bumping each other. And also another thing is some kind of like accident, like maybe also car accident or something like that. But this one, so the high school, that means it's a teenager. So the most of reason, what caused the death reason, there's several. So I'm going to tell you this. Okay, that's why you just make a note. It's one of the answer inside. The number one reason is the suicidal ideation. We talk about this many times. So that means what? That means they cannot looking for the peers support and they feeling depressed. That's why they have a suicidal ideation. Okay, this is number one. And then number 2 is they're looking for something kind of like excited. Okay, they want to do something kind of like so thinking about they conquer with something they are like a Superman. So that's why they like to racing the car like a car accident, or they like to jump diving, okay, from a very high cliff, or just like a high swimming pool, something like that. Just something kind of stupid, something silly. This is number 2 reason. Okay, the number 3 reason is a substance abuse and overdose. That's why they die. So, for example, like taking like a heroin or cocaine, something like this, or like drinking too much and cause the alcohol toxicity. Okay, this 3 reason I forgot to tell you is for happen to the adolescent, for the teenager. The most of 3 reason cause they have like accidentally die. So this question is one of the answer here. All right. Number 10. So 5 years old child abuse intervention. Okay, so when a child come into your clinic or to your office, you feel that this child is under suffering for some kind of abuse. So what should you do? How are you screening with this child? How can you provide a privacy? How you engage with this child? Okay, it's not that hard. So my PowerPoint, I just highlighted the real one. And remember, I told you something very, very important. Okay, so can you separate the child with their parents? In this case, yes or no?
Yes.
Yeah.
Yes.
You need to separate them. Okay, I'm so sorry. So that means the caregiver or the parents, you cannot get in touch with this child because it's a suspicious abuse. 11. So remember this disease? Acute glomerulonephritis. The cause reason. Is some kind of bacteria. Okay, that bacteria we talk about is going to damage to your heart in the term 2. But now the term 3, I'm going to tell you, okay, this bacteria also will damage to the kidney.
Streptococcus.
Yes, streptococcus. Yes. All right. The number 12. Okay, the acute glomerulonephritis. The condition is improving. How can you know this patient is improving right now? That means the infection is getting control, right? So when the infection is getting control, what will happen?
Increased level of consciousness.
Yeah, that's one of this. Yes. Okay. But here the infection is getting better. Control is better. So one thing is actually is a vital sign getting better. Okay, so that's why this question, one of the answer is a vital sign is getting better. But I'm not going to tell you which vital sign. Okay, so that's why you go to check, you will find out. One of the answer is there. Vital sign is getting better. That means what? Infection is getting more clear. That's why patient doesn't have some kind of vital sign significant change. Okay, so this question they did not tell you any kind of urine. You should be also have like a urine getting improved. You had the patient had more urine. Okay, but they didn't tell you the urine. They talk about the vital sign. All right. So the number 13, reverse tumor nursing intervention. This one I forgot to tell you. Okay, it's very, very important. Okay, so the reverse tumor have like a very important nursing intervention. Is do not palpate the reverse tumor site. If you suspect that part is maybe have like a reverse tumor, do not palpate, do not hard like palpate a little bit deeply or hardly, because the tumor is going to be ruptured. Because the tumor rupture very easy. When the tumor rupture inside the kidney, actually will cause a severe bleeding. Because kidney is also the organ will have lots of blood. So that's a do not palpate where's tumor. Okay, number 14, hypospadias. So the delaying circumcision, the reason why we want to delay the circumcision, why we don't do the circumcision from the beginning if the patient have this problem. They want you explain the reason.
We need the foreskin.
Yeah, we need a foreskin to do the surgery or helping the surgery, because the foreskin will cover the hole. So that's why in the future, the patient will be peeing, is not peeing out from that hole anymore. Okay. 15. So episipedics. So the post-op care. That means after the surgery care. So that's why this is all the hint here. Okay. Can they take a bathtub? The top bath?
No.
No.
No, the answer is no. Okay, but be careful. Be careful. The answer is tricky. Be careful. The answer is tricky. The answer is telling you something, and actually, in one condition, the patient can take the top bath. So that's what I want you to think. In what condition the patient can take the tap bath? They can take a bath. In what condition?
If they don't submerge the surgery site?
So what happened to the surgery site?
If they don't submerge the surgery site?
You don't need to think too so complicated. Think about it easy, a little bit easy. Okay, let me guide
If
you.
they cover the surgery sites?
Yes, thank you so much. So, if we do have a concern, that means what? The patient is not well, right? But if a patient is well recover, so that's why this is not contraindication anymore. Okay, so this patient, because we're doing a surgery, so this patient will be put on a Foley caster because the Foley caster actually is like a new pathway for this boy can pee. So that's why from the beginning we'll put a Foley caster. So when the doctor take out the Foley caster, that means what? If doctor decide want to take out the Foley caster, that means what? That means the patient is recovering, right? So, do you think in that timing, patient is take out the Foley caster totally, they can independent to pee? Do you still thinking about taking the bath is still contraindication?
Yes.
No.
No more. Yeah, no more. Okay, that's why be careful. That's what I'm telling you. Be careful. The answer is tricky. Okay, don't just let the answer just trick you. Okay. Okay. The second one, the diaper. So how about we change the diaper? Do you think the diaper make it like too tight is good?
No.
Is it cutting the
No.
circulation? Okay. How about the bubble bath?
No.
No.
Remember,
No.
Uncle has never liked bubble baths. Okay, we do not like bubble baths. The bubble baths have lots of effect. The bubble bath is actually the bubble will increasing the bacteria surviving. Yeah, the bubble bath, it will increasing the bacteria surviving in the water. So this is the reason we do not like bubble baths. Okay, so the rocking horses. That means what? That means have you seen the horses? The children was riding on it and will be like rocking, around like a rocking chair. Do you think this patient have this kind of like a problem and have like a Foley caster layer, have a surgical site layer? They can just do the rocking horses.
No.
No.
No. Jumping in the bed?
No.
No.
No. Remember, they may have a Foley caster. That means what? They may have also Foley bed. They have a Foley bed. So that's why it's not nice. They're jumping in the bed, jump. The kids, they probably is very naughty. They want to jump, right? No. You don't jump in the bed, okay? And then roll over. Roll over in the bed. Rolling to the left side, rolling to the right side.
No.
No. Okay. How about a soft restraint?
Yes.
It may be necessary. Why? Because we do not want it to touch the surgical site. Okay, so soft restraint may be necessary. Okay, that's why be careful the answer. See, if the patient want to touch the surgical site, that means soft restraint is necessary. But if the patient is not doing this, that's why we don't restrain the patient. Okay. All right. 16. The post-op. So all kids all palsy. So do you remember what is this surgery? So is a patient their testicle is not going down to their scrotum. So that's why we have this surgery. We cut it and then we pull all the testicle down to the scrotum. All right. So after the surgery, have like a bleeding. The patient is bleeding. The bleeding complication. So what's your nursing intervention? This one is very easy. Don't think too much. Just directly. It's emergency
Notify-
care.
Notify the provider.
We need to tell the doctor for sure, right? But before we tell the doctor, we do something.
Blood
Mm,
pressure?
Yes, apply the pressure. Please go get a gas and apply the pressure and stop breathing. Okay? And then 17, circumcision, the patient education. Okay, this is also not difficult. It's all in my PowerPoint circumcision. Okay, so you are educate the parents. So how can they taking care of the circumcision? So how we do the circumcision, the post-op care. Okay, I give you several hints. Okay, the first thing is we're gonna put a ointment. Okay, so when we put an ointment, so every time when we change a diaper, do we also wipe out the ointment? Do we also clean the ointment and put a new one?
Yes.
Yes, because the ointment also be kind of stained with the urine and feces. That's why we don't want this kind of urine and feces still stay there. That's why we just clean the ointment and apply the new one. Okay, how about the diaper? We cut the diaper. We put in a tie, make it tie.
No.
No. Circumcision, because the surgical site need to be healed. That's why they need circulation. So please do not make a diaper too tight. Okay. So the patient maybe also have a Foley caster. Maybe yes or maybe no. So can we remove the ring by ourselves? Remember circumcision have a ring there?
No.
No.
That's the no.
Yeah, they have a ring there. Okay, please do not remove the ring. Okay, and also monitor with the surgical site. We have any kind of breathing infection, right? Okay, the circumcision, the kids will have some kind of like the yellowish crust or yellowish some kind of like a jello like. So do you wipe it out?
No.
No, don't wipe it out. That's normal. That's normal. So the kids healing, but because they're a little baby, okay, so that's why their body have lots of fat. So that's why they're actually secreting some kind of fat, some fat tissue, and it's helping them to heal. So don't wipe it out. This is normal. Okay, how can I clean? Yeah, when I do the diaper change, do I use the cold water or super hot water?
No.
Lukewarm water.
No.
Okay.
Yeah.
Yeah.
No hot water.
No water, yeah, lukewarm water. Okay, so that's why you can use the gas or the towel, lukewarm water and pet dry. Okay, pet dry. Don't just very hard to wipe it. Okay, all right. 18. Developmental dysplasia of the hip education. Remember, this kid is wearing some kind of like the case, right? So they have a different case. They have like the normal case, also the case with a harness. So the harness is usually on the chest area and will be holding the both leg. Okay, so that's why they're asking you. The education is how you taking care of these kids. Okay, the first thing is so the cotton undershirt, like we have like a t-shirt undershirt is under the harness. Do you think this is a good practice?
No.
Yes.
Actually, yes, it's good. So remember, with everything with a harness or with any kind of like a medical device. Okay, so that's why we want the patients wearing some kind of like a cotton T-shirt under it. So that's why prevent a skin friction. Okay, that's why you can see the number 20 and Milwaukee, the brace. We also tell this teenage girl wearing the T-shirt. Okay, so even this little baby wearing with this kind of like a harness, so wearing the cotton T-shirt is good. So do you put a lotion under the skin and under the strap? Under the strap, prevent the rubbing. You put a lotion? No, we don't put a powder and a lotion. Okay, we don't. Okay, you know why? Because actually we're making the strap have that kind of like absorbing with because it's a wet, we're absorbing some kind of bacteria. So that means what this strap is going to be dirty very easy. Okay, will cause a skin rash. And also the powder and also the lotion will be staining there and will be become like a crack. So that's why we don't like it. So that's why we don't need a lotion or the powder layer, not necessary. So just change the t-shirt, okay? Do you adjust the harness and the strap weekly?
No. Not weekly.
Actually, it's not weekly. And also another reason is who have a right can adjust the harness?
Doctor.
Doctor.
Yes. Is a pediatrician, okay, is a provider. So even the nurse, we don't have a right can adjust it. Even I adjust last time because I took care of this patient before. But just let you know, okay, the NCLEX wants you to know, okay, the doctor is the one doing the assessment, and that's why they will adjust the harness, okay. So remove the harness during the diaper change. Do you think this is necessary?
No.
No. Okay, no. So the patient is gonna wear this harness at 23 hours. Okay, all this kind of like a medical device on the pediatrics, 23 hours because we want to make sure the bone is growing well. Okay, that's why 23 hours. Only when they're taking the shower, we took it out for 1 hour. They will take a break, just only 1 hour. They're sleeping with a harness. Okay, with a cast. All right, 19. Psychosis and psychosocial communication skill. So this question actually is asking you the communication skill related to the psychosocial things. So the patient is actually telling you something. Okay, I have a psychosis. I feel shame. I feel very low self-esteem. So what should you talk to her? Okay, it's a communication skill we're learning from the mental health. Okay, so you will know it when you see the answer. Okay, so be the compaction. So that's why repeat when patients say clarify. Oh, just telling the patient, I know you have a hard time, so I'm feeling it. So that's what I say. Also some kind of like things is just stand on the patient's side to talk for the patient. Okay, so maybe we have another way to helping you out. Okay, so do you want to try this or do you want to try that? So this is a communication skill. So that's why don't let the patient give up so easy. Okay, don't let the patient give up. So 20 Milwaukee brace for the sclerosis intervention. So what will happen to this patient was wearing this kind of brace? Remember, I tell you, this brace is very dramatic.
Their self-esteem.
What? Say that again?
It lowers their self-esteem.
Yes, for sure, right? But here is a little bit more like a physical intervention. So, do we also encourage her to wear the t-shirt, the cotton t-shirt?
Yes.
Yes, okay, the same. No powder and no lotion, no gel, okay. And can we adjust it? No, the same. Okay, like a harness, we don't adjust it. Okay. So how long patient need to wear this every day?
23 hours.
23 hours. So the patient is also asking you, do I have to wear this to sleep?
Yes.
Yes, unfortunately, I'm sorry. Yes, you have to wear this to sleep. Okay, even when you're sleeping, we still want this the bed rest, and it can support with your back, support with your lumbar. Okay, your spine. Okay, all right. So this is 20 question. Any question? Oh, this 20 question we're gonna use the canvas. Okay, so the canvas is best. So that's why I put this question, all these 20 questions on the canvas already. So remember Tuesday, bring your own computer. Okay.
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 Yes.
So 20 question, we don't have a select all apply. Okay, don't worry about it. It's all multiple question. It's all multiple question, only one answer. Okay, take your time, think a little bit, but it's not difficult because it's just only quiz. Okay, so I will start making with your final ATI. So Tuesday we can review the final ATI. Okay, and we also have one final lecture. So Tuesday, we are going to review the ATI and finish the lecture. I will see the time. If we do have a time, if I feel like we have extra time, do you guys want to take like a ATI calculation? You want to take a calculation first?
Yes.
Yes.
Okay, so we can still take a calculation. We will see the time. Okay, so if I can finish the lecture and also finish with the review, we can take a calculation. Okay, that means that Thursday you only have two exam. Your final with me and also final ATI proctor. Okay, so Mr. William is going to be here on Thursday.
No.
It's okay. He's not.
No,
He's
not
not.
okay.
He's not teaching. He's just holding the exam only. Okay.
Even if not okay.
He's fine. Just be nice to him. Okay. Be nice to him. All right. So I will dismiss you guys, and so just go study a little bit and get some rest, because you have a clinical rotation tomorrow and Sunday.
Okay, thank you.
You're
Thank you,
welcome.
Patrick.
Have a good
Yeah,
night.
have a good
Yeah.
night. Bye.
Have a good
Bye,
night.
Patrick.
Thank
Bye.
you.